Hello everyone, today we're gonna review the upper limb radioanatomy. First we have a shoulder joint. This modality is a plain X-ray and the view is anterior posterior. 1 we have the head of the humerus, 2 we have the greater tubercle of the humerus, 3 we have the surgical neck of the humerus, 4 we have the glenoid cavity of the scapula, 5 we have the coracoid process, 6 we have the lateral end of the scapula, 7 we have the lateral end of the clavicle, 8 we have the acromial process. Here we have another shoulder joint. This modality is plain X-ray and the view is axial. 1 we have the surgical neck of the humerus, 2 we have the head of the humerus, 3 we have the glenoid cavity of the scapula, 4 we have the spine of the scapula, 5 we have the acromial process, 6 we have the lateral end of the clavicle, 7 we have the coracoid process, 8 we have the lateral border of the scapula, and 9 we have a junction between the lateral 1/3 and the medial 2/3 of the clavicle. Here is another shoulder joint. The modality is plain X-ray and the view is anterior posterior. 1 we have the clavicle, 2 we have the acromioclavicular joint, 3 we have the acromial process, 4 we have the coracoid process, 5 we have the head of the humerus, 6 we have the glenoid cavity of the scapula, 7 we have the lesser tubercle, 8 we have the greater tubercle, and 9 we have the intertubercular groove, 10 we have the spinous process of the scapula, and 11 we have the lateral border of the scapula. Here we have the elbow joint. This modality is an MRI scan and it is an axial view. 1 we have the brachyradialis, 2 we have the pronator teres, 3 we have the brachialis, 4 we have the radial nerve, and 5 we have the ulnar nerve. Here we have another shoulder joint. The modality is MRI and the view is oblique coronal. 1 we have the lateral end of the clavicle, 2 we have the acromial process of the scapula, 3 we have the head of the humerus, 4 we have the glenoid cavity of the scapula, 5 we have the superior glenoidal labrum, 6 we have the inferior glenoidal labrum, 7 we have the surgical neck of the humerus, 8 we have the deltoid muscle, 9 we have the supraspinatus muscle, and 10 we have the tendon of the supraspinatus muscle. Here the modality is MRI of the shoulder joint and it's an oblique coronal view. 1 we have the subscapularis, 2 we have the deltoid muscle, 3 we have an axillary fat, and 4 we have the tendon of the subscapularis muscle. Here we have the elbow joints. The modality is MRI and the view is coronal. 1 we have the lateral epicondyle, 2 we have the medial epicondyle, 3 we have the ulna, 4 we have the radius, 5 we have the common extensor origin, 6 we have the extensor carpi radialis longus, 7 we have the extensor carpi radialis brevis, and the arrow points toward the radial collateral ligaments. Here is another shoulder joint. The modality is MRI. 1 we have the glenoid cavity of the scapula, 2 we have the head of the humerus. Here is the same. 1 we have the glenoid cavity of the scapula, 2 we have the head of the humerus, 3 we have the acromioclavicular joint, 4 we have a dye around the inferior glenohumeral ligament, 5 we have the inferior labrum with the inferior glenohumeral ligament, 6 we have the subscapularis, 7 we have the supraspinatus, and 8 we have the infraspinatus muscles. Another shoulder joint, the modality is MRI and it's oblique coronal view. 1 we have the head of the humerus, 2 we have the glenoid cavity of the scapula, 3 we have the acromioclavicular joint, 4 we have the subacromial bursa, 5 we have the superior labrum glenoidal, 6 we have the inferior labrum glenoidal. Here is another shoulder joint, MRI modality, axial view. 1 we have the head of the humerus, 2 we have the lesser tubercle of the humerus, 3 we have the greater tubercle of the humerus, 4 we have the intertubercular groove contains bicipital tendon. 5 we have the subscapularis muscle. 6 we have the infraspinatus muscle. 7 we have the glenoidal cavity of the scapula. 8 we have the anterior labrum glenoidal, and 9 we have the posterior labrum glenoidal. Here is another shoulder joint, MRI modality. 1 we have the supraspinatus muscle. 2 we have the infraspinatus muscle. 3 we have the teres minor muscle. 4 we have the subscapularis muscle, and 5 we have the glenoidal cavity. Here's the elbow joint. This is an MRI modality, coronal section. 1 we have the lateral epicondyle of the humerus. 2 we have the medial epicondyle of the humerus. 3 we have the head of the radius. 4 we have the coronal process of the ulna, and 5 we have the olecranon fossa, and the arrow points toward the ulnar collateral ligament. Here is another shoulder joint. This is an MRI modality and oblique coronal view. 1 we have the head of the humerus. 2 we have the anatomical neck of the humerus. 3 we have the surgical neck of the humerus. 4 we have the greater tubercle of the humerus. 5 we have the glenoidal cavity. 6 we have the supraglenoid tubercle. 7 we have the infraglenoid tubercle. 8 we have the lateral end of the clavicle. 9 we have the acromial process. 10 we have the deltoid muscle. 11 we have the subscapularis muscle, and 12 is the lateral border of the scapula. Another shoulder joint, the view is axial. 1 we have the greater tubercle of the humerus. 2 we have the head of the humerus. 3 we have the middle fibers of deltoid muscle. 4 the posterior fibers of deltoid muscle, and 5 the anterior fibers of deltoid muscle. 6 we have the subscapularis muscle. 7 we have the infraspinatus muscle. 8 we have the glenoid cavity of the scapula. 9 we have an axillary fat. 10 we have the lesser tubercle, and 11 we have the intertubercular groove contains bicipital tendon. Here we have the wrist joint, plain X-ray modality. 1 we have the radius, 2 we have the head of the ulna, 3 we have the styloid process of the ulna. Let's start with the bones. 4 we have the scaphoid. 5 we have the lunate. 6 we have the tracheatrium. 7 we have the pisiform. 8 we have the trapezium. 9 we have the trapezoid. 10 we have the capitate. 11 we have the hamate, and 12 we have the styloid process of the radius. Another elbow joint. This is a plain X-ray. Another elbow joint. This is a plain X-ray modality, anterior posterior view. 1 we have the olecranon fossa. 2 we have the lateral epicondyle of the humerus. 3 we have the medial epicondyle of the humerus. 4 we have the head of the radius. 5 we have the neck of the radius. 6 we have the shaft of the humerus, and 7 is the olecranon fossa. This is a plain X-ray modality, lateral view. 1 we have the radius. 1 we have the head of the radius. 2 we have the neck of the radius. 3 we have the radial tuberosity of the radius. 4 we have the olecranon process of the ulna. 5 we have the trochlea and capitulum overlapped, and 6 we have the ulna. Here is a wrist joint, MRI modality. 1 we have the ulna, 2 we have the radius. Now for the bones, 3 we have the tracheatrium, 4 the lunate, 5 the scaphoid, 6 the hamate, 7 the capitate, and 8 the trapezoid. Here is another wrist joint, the MRI modality, axial view. 1 we have the ulna, 2 we have the radius. Here is the same, 1 we have the ulna, 2 we have the radius. 3 we have the Lister tubercle. 4 we have the extensor pollicis longus and the abductor pollicis brevis. 5 we have the extensor carpi radialis longus. 6 we have the extensor carpi radialis brevis. 7 we have the extensor digitorum. 8 we have the extensor carpi ulnaris. 9 we have the long flexor tendon. 10 we have the median nerve. 11 we have the ulnar nerve. 12 we have the flexor pollicis longus. 13 we have the long flexor tendons, and 14 we have the extensor carpi ulnaris. Here is a view of the hand. The modality is plain X-ray. 1 we have the lower end of the radius. 2 we have the lower end of the ulna. 3 we have the styler process of the ulna. 4 we have the styler process of the radius. 5 we have scaphoid. 6 we have lunate. 7 we have tracheatrium. 8 we have trapezium. 9 trapezoid. 10 capitate. And 11 the hamate. 12 we have the first metacarpal. 13 we have the proximal phalanx of the thumb. 14 we have the proximal phalanx of the index. 15 we have the middle phalanx of the middle finger. And 16 we have the terminal phalanx of the middle finger. Here is the arteriogram or angiogram, subtracted angiography of the axilla. 1 we have the subclavian artery. 2 we have the axillary artery. 3 we have the brachial artery. 4 we have the posterior circumflex humeral artery. 5 we have the anterior circumflex humeral artery. Another angiography, this time is for the forearm. 1 we have the brachial artery. It divides into 2 arteries, the ulnar artery and the radial artery. And for number 4 we have the anterior interosseous artery. Another angiography or arteriography for the hand, subtracted hand angiography. 1 we have the ulnar artery. 2 we have the radial artery. 3 we have the deep palmar arch. 4 we have the branchies pollicis. And 5 we have the radialis indicis. This is the end of our review. Thanks for watching.